Good morning, good evening, good afternoon. My name is Matthew Spott, and today is my proposal defense. My problem of practice is Are knowledge, motivation, and organizational factors related to perceived organizational effectiveness within the pharmaceutical industry? Only white people, specifically white people of privilege, should have access to life-saving and life-altering pharmaceuticals. I hope hearing that made you stop in your tracks and think to yourself, that is incredibly distasteful and incredibly wrong. And you're absolutely right. But I had to grab your attention. The health of a community and the health of the world is everybody's responsibility, and it is dependent upon everybody having the same access, knowledge, and ability to receive pharmaceuticals. These are my children. I want them to grow, and my wife. She's holding the baby. I want my children to grow up in a world where everybody, regardless of race, nationality, ethnicity, and income level, has the same opportunity to enjoy a healthy and happy life. And I personally believe that the health of the nation is dependent upon everybody's ability to not only have access to drugs, but the knowledge of them, the comfort to take them, and the ability to afford them. Of all the races, Black people had the lowest number of COVID-19 vaccination rates. Black Americans are more likely to suffer from chronic pain, diabetes, high blood pressure, and other diseases that have the ability to be cured and or treated. The life expectancy of a Black man is nearly 5 years less than that of a white man. During the height of the COVID-19 pandemic, Black people were more likely not only to contract the disease, but also die from the virus. The death rates from preventable and manageable diseases and conditions between the ages of 0 to 65 are 77% higher in the African American population. And if you think to yourself, well, I'm a white person, none of these things so far, impact my life. I want everybody to realize that the health of a nation has a much bigger impact than simply just somebody's ability to feel good and be healthy and happy. It also impacts almost every aspect of a person's day-to-day life. During during COVID-19, the economic impact in the US alone will reach a stagnant $14 trillion by the end of 2023. In case you're wondering what that looks like in comparison to other recessions, just notice the little chart at the bottom where at the height of the COVID-19 recession, there was a 14% drop in the difference in, in the jobs that were available before the start of the pandemic. This is significantly greater than any other recession that the US has ever been through. For this, I'm going to be examining 4 research questions. To what extent are knowledge, motivation, and organizational influences preventing commercial leadership in the pharmaceutical companies from diversifying their employee workforce? Number 2, are knowledge, motivation, and organizational factors related to perceived organizational effectiveness? Number 3, what are some knowledge, motivation, and organizational recommendations for improving the ability of commercial leadership in the pharmaceutical companies and their diversification of their employee workforce? Number 4, to what extent do knowledge, motivation, and organizational factors relate to organizational effectiveness? The theoretical framework for my study is based on Clark and Estes gap analysis and KMO. What this actually does is it focuses on 3 different areas that can be related to the driving performance of the organization. Number 1 is knowledge, and it includes what and how, and the conceptual why. Motivation, it includes self-efficacy, the expectancy value and goal orientation, and the organization, which includes elements surrounding cultural models, cultural settings, training, and leadership. The conceptual framework is the gap analysis. And what this will actually measure is How do knowledge, motivation, and organizational methodology actually relate to organizational effectiveness, with recommendations brought in to help them limit and close the gap between where they are in comparison to where they ultimately want to be as an organization. Data collection methods and procedures. For this, I will be surveying commercial employees within the pharmaceutical industry. This consists of client services, sales, marketing, patient retention, patient access, and other areas within the commercial sector. I will be using a quantitative approach using a Qualtrics survey with a focus on perception analysis to maintain anonymous responses. My surveys will be delivered via email. Thank you so much. I look forward to your feedback, and I look forward to continuing this journey and helping improve the pharmaceutical industry achieve a status where everybody, regardless of race and prosperity levels and income levels, has access to life-saving and life-altering therapeutics. Thank you so much. Have a wonderful day.